The full-scale invasion of Ukraine in February of 2022 created a military crisis of immense proportions. It also created a profound medical and humanitarian emergency. Critical infrastructure, hospitals were destroyed. Doctors and civilians were displaced. Thousands upon thousands were wounded or killed, and the Ukrainian healthcare system faced a surge of demand unlike any it had ever faced before. It was in this moment of dire urgency that the origins of the Ukrainian Alliance for Medical Exchange and Development, UAMED, were forged, and we've only grown in numbers and in strength since then. Come join us as a part of the growing consortium of academic medical leaders and non-governmental organizations that are striving forward to build resilience and healthcare capacity for Ukraine and learning the lessons that can be applied across the globe.
UAMED is not a single organization. It is a coalition, a collaborative platform uniting Ukrainian physicians with academic leaders and humanitarian partners across the globe. Its mission is simple but powerful: to strengthen Ukraine's healthcare system in the midst of the war, while also contributing to new knowledge in global medicine. We work with top officials and healthcare leaders in Ukraine to address the crisis of war and build healthcare capacity for the future. So what does UAMED actually do? Its work spans several critical domains.
First, training. Ukrainian doctors and nurses are learning from some of the best in the world through a hybrid model: observerships at leading academic medical centers abroad, in-country workshops tailored to trauma and emergency medicine, and virtual courses available anywhere, anytime. This combination of exposure, mentorship, and guided practice is already transforming how care is delivered in Ukraine's hospitals today.
And UAMED does not stop at physical healthcare. Mental health, particularly for veterans, amputees, and civilians scarred by the trauma of war, has become one of its core missions. The Alliance is helping Ukraine to build a trauma-informed system of psychological care that will be vital for recovery long after the war is over.
Second, conferences. UAMED brings together experts in trauma care, oncology, infectious disease, mental health, rehabilitation, and all manner of subspecialties to focus on Ukraine's most urgent medical needs. These aren't just local events. They are global gatherings that shine an international spotlight on Ukrainian healthcare and keep the country's challenges and innovations at the center of worldwide medical dialogue.
This fall, our conferences in Kyiv, Lviv, and at Harvard University in the United States continue these evolving conversations, bridging Ukrainian healthcare leaders with their global counterparts. We've also supported the participation of Ukrainian academic physicians in major global conferences from ASCO to RSNA, from the American Burn Association to the European Congress of Radiology. Ukrainian clinicians are no longer observers of global medicine. They're active contributors, presenting research, building partnerships, and ensuring their frontline lessons are heard on the world stage.
Third, publications. Since the war began, UAMED participants have authored more than 50 peer-reviewed articles in leading journals, with more underway. But these papers aren't just academic. They document entirely new realities of modern warfare medicine, from managing injuries caused by drones to evacuation protocols in contested airspace. Ukrainian physicians are teaching the world how to adapt trauma care to 21st century battlefields. A landmark achievement was a recent article published in The Lancet, only the third ever to originate from Ukraine.
Finally, coordination. UAMED has invested in building communication networks that connect doctors in the field with global experts in real time, while also aligning efforts with Ukraine's Ministry of Health, the Healthcare Committee of Parliament, and the Ministry of Youth and Sports in partnership with the Ukrainian Paralympic Committee. These relationships ensure that medical aid is not only effective today, but also contributes to lasting system reform tomorrow.
At its heart, UAMED is built on the principle of reciprocity. Western institutions provide training, resources, and academic pathways, but at the same time, they're learning from Ukraine's frontline innovations, discoveries forged in the crucible of war. Lessons that will prepare all of us for the challenges of future crises. The Ukrainian Alliance for Medical Exchange and Development is proving that even in the darkest moments, collaboration can produce light. It is strengthening Ukraine's health system, it is advancing global medical knowledge, and it is building the foundations for resilience that will last long beyond the end of this war.
Please join a growing alliance working to build healthcare capacity for Ukraine and its partners around the world. Become a part of UAMed. Slava Ukraini!